This is such a great question. And in short, the answer is yes. A primary care doctor can diagnose you with POTS. But if you had asked the same question 5 years ago, I probably would have told you no. And let's talk about why. So, POTS treatment pre COVID and post COVID, I believe, are completely different. Pre-COVID, people like myself, it took me, 18 years to get diagnosed, pretty much my entire life. And honestly, if we add up the time in adolescence before that, we're looking at 22 plus years to get a proper POTS diagnosis. And I went to many, many specialists. My primary care doctor told me that I most likely had POTS, and I actually waited for 2 years to see a POTS specialist to get an autonomic nervous system test to find out that I officially, per my medical record, had POTS. With so many people who get COVID getting POTS-like symptoms, it's forcing the medical system really to adapt. So while an autonomic official tilt table test is really effective at finding out if you have POTS or not, many doctors that I've spoken to recently are considering it kind of antiquated and are diagnosing people in office, which is great because you can do a tilt test in office. There's no reason why they can't lay you down flat and do the test. And what's funny is teenagers already are diagnosed with POTS without having a tilt test done. They can diagnose a teenager in office. There's really no reason why they can't diagnose an adult. So you can absolutely talk to your primary care doctor. Most specialists are full. My doctor, who is one of the only, I think, two POTS specialists in the state of Oregon, was on a 26-month wait list when I saw her. She completely shut down her wait list, I think about a year after that, at 800 people. So most people can't see a POTS specialist. And on top of that, tilt tests, like official autonomic tilt tests, are very expensive. And that's a luxury that a lot of people simply cannot afford. If I had had to pay out of pocket, there's no way I could have gotten a formal autonomic test done. So you absolutely can talk to your primary care doctor. We actually have a at-home calculator you can use to be able to take that information to them. And if you need any help advocating, just DM us. I am super happy to help you in any way I can. So you can talk to your primary care doctor about it.